The emergency sirens wailed through the corridors of Zelvery Station, a shrill reminder of the chaos unfolding. Medical Officer Zyra Kell's 4 hands moved with practiced precision as she applied the stabilizing gel to a patient's chest. The gel hissed on contact, sealing the torn membranes, but the vitals display flashed an unforgiving crimson. Another loss. Another life slipped away despite their best efforts. Radiation surge caused multi-organ collapse, she muttered, recording the cause of death. The tally was growing at an alarming rate. Officer Zyra, came the voice of Commander Varith over comms, clipped and strained. Status? Critical, she answered, wiping away a stray bead of condensation from her brow. We've lost 37% of casualties. The neural regulators can't handle the damage. Static crackled before the commander responded. Human medics en route. ETA 6 minutes. Zyra's antennae twitched in surprise. Humans? Why? Joint protocol. Deathworlders are aggressive with trauma care. HQ approved their involvement. Aggressive. The word made Zyra's mandibles click with disapproval. Humans were known for their risk-taking methods. Bold, unpredictable, and reckless. Medicine required caution, precision, not brute force interventions. But there were too many bodies now, and not enough answers. She turned to the holoboard, displaying biostatistics for the most critical patients. Organs failing. Neural links deteriorating. Radiation toxins running unchecked through veins. Zelvery protocols dictated palliative measures at this stage. Comfort, not survival. The door to the med bay hissed open. A tall figure in a soot-streaked uniform strode in, helmet under one arm, sweat glistening on his brow. His eyes scanned the chaos with sharp efficiency. Jack Carter, Earth Emergency Response Corps, he said briskly. Point me to the worst of it. Zyra stiffened. His uniform carried no insignia of rank, just the insignia of Earth's Crimson Serpent and Rod, the universal medical alert for human trauma specialists. We have 12 in critical condition, she said, voice guarded. Their nervous systems are collapsing. We've exhausted neural inhibitors. Carter's jaw tightened as he moved toward the nearest patient. The Zelvery's skin had turned ashen gray, oxygen saturation plummeting. Plasma burns across 60% of the thoracic region, Zyra explained. Radiation poisoning. Protocol recommends. Yeah. Protocol says it's hopeless, Carter interrupted, kneeling beside the patient. But let's try something different. She opened her mouth to protest as Carter retrieved a compact injector from his kit. The label read, epinephrine, high dose, human use only. That's not compatible with Zelvery neurochemistry, she said sharply. Maybe. Or maybe it'll kickstart systemic regulation, Carter countered. Right now, this guy's dead unless we give it a shot. Before she could stop him, Carter pressed the injector into the patient's neck and released the dose. The vitals monitor screeched in protest. Heart rate spiked erratically, blood pressure surging. You're killing him, she hissed. Carter's eyes remained locked on the screen. The erratic beeping slowed. Stabilized. Oxygen levels rose, pigmentation returning to pale blue. The patient coughed weakly. Zyra's breath caught. Impossible. Deathworlder medicine, Carter said, standing. We don't quit easy. Zyra Kell stood frozen, eyes locked on the vitals display. The patient who should have been dead was breathing, stabilized by a chemical never intended for his species. Her mind raced through years of medical training, protocols etched into her memory, and none of them explained what she had just witnessed. That dose should have caused neural overload, she said, voice low. Should have, Carter agreed, already moving to the next critical patient. But humans figured something out after a few centuries of patching each other up. Rules don't always apply in emergencies. She followed him on autopilot. The next patient lay sprawled across the biobed, tendrils limp and colorless. Internal hemorrhaging showed on the scanner, an outcome Zelvery surgeons considered untreatable without fully sterilized conditions. We can't operate here, Zyra said, gesturing to the compromised environment. The filtration systems were still offline, the air thick with microscopic debris. Carter didn't respond. He dumped his medpack onto the tray, pulling out an old-fashioned scalpel alongside a high-frequency coagulator. No sterile field, no surgical drone, just human hands and primitive tools. "You're seriously going to cut into him like this?" she asked, incredulous. "Yup," he said, donning a pair of thin polymer gloves. "If we wait for perfect conditions, he dies." The scalpel bit through alien flesh with brutal efficiency. Zyra expected chaos, contaminants triggering shock or the tissue collapsing under unsanctioned instruments. Instead, Carter worked with relentless focus, using the coagulator to cauterize vessels as he went. "Humans don't rely on machines for everything," he said, eyes never leaving the exposed tissue. "Sometimes, instinct and speed beat precision." She stared as he sealed a ruptured artery with practiced ease. He didn't pause, didn't hesitate, simply adapted in real time. "You treat bodies like puzzles," she said softly. "Living puzzles," Carter replied. "And we hate losing." The patient's vitals stabilized within minutes. Carter stepped back, wiping his brow with the back of his wrist, and gestured toward the biobed. "Patch him up. He'll need respiratory support for a while, but he'll live." Zyra moved to apply regeneration gel, hands trembling. She had seen advanced medical teams at work before, precise, methodical. This was something else entirely. Raw determination, backed by knowledge and a willingness to gamble everything for survival. The comm crackled to life. "Human team, report," Commander Veritha's voice demanded. Carter tapped his wristcom. 2 stabilized, 8 critical still pending. "We need more vasoconstrictors and plasma expanders." "You've already exceeded dosage safety margins," Verith snapped. "Yeah, well, safety doesn't matter if they're dead," Carter shot back. "Send the supplies." Silence stretched across the channel before the commander relented. "Understood. Supplies en route." Zyra exhaled shakily. "You're pushing these patients beyond their biological thresholds. If this backfires. If we don't push, they die," Carter said. He grabbed his pack and headed toward the next case. "This isn't about playing it safe. It's about giving them a fighting chance." Zyra hesitated. Then she followed him. For the first time in her career, she wasn't following protocol, she was following hope. The med bay was a war zone of urgency and exhaustion. Machines hummed, alarms screeched, and the metallic tang of burnt circuitry lingered in the recycled air. Zyra Kell's hands ached from non-stop work, yet she moved with Carter from patient to patient, applying treatments she would have considered reckless hours ago. Lives were stabilizing. Against all logic, human techniques were working. But one case refused to yield. The alien child lay on the central biobed, small and fragile beneath layers of medical wraps. Radiation had shredded his vascular system, and his heart struggled against systemic collapse. The biocomputer's prognosis was unforgiving, 97% fatality probability. Carter stood beside the bed, jaw tight. "He's got minutes," he muttered, setting down his scanner. "We need to bypass the damage." Zyra frowned. "Bypass? His heart is compromised. Zelvery physiology relies on dual circulatory synchronization. If one side fails, we'll replace the function manually," Carter interrupted. He unsealed a portable ECMO unit from his pack, a human life support device designed for field use. "We'll oxygenate his blood externally." She hesitated. ECMO protocols were complex, even for humans. Applying them across species borders without compatibility data? It was a leap into the void. "That machine isn't calibrated for his biochemistry," she warned. "Neither was the vasopressor," Carter shot back. He hooked the device to the child's vascular ports with meticulous speed. "We improvise, or we lose him." The machine whirred to life. Blood flowed through synthetic membranes, stripping toxins and reintroducing oxygen. The child's vitals stabilized briefly. Then the heart monitor flatlined. "Cardiac arrest," Zyra shouted. "He's crashing." Carter grabbed the defibrillator paddles. "Clear." A jolt surged through the child's body. No change. The monitor remained a monotone death knell. "His nervous system can't handle the stress," Zyra said, voice cracking. Carter stared at the monitor, sweat running down his temples. His eyes hardened. From his medkit, he pulled a vial with a handwritten label, Norepi, experimental. That's untested, Zyra gasped. Exactly. No one said survival was guaranteed. He loaded the vial into a cardiac injector. But sometimes you fight with what you've got. He injected the drug directly into the child's heart. For 3 agonizing seconds, nothing happened. The monitor blipped once. Another blip. A rhythm formed, weak but steady. Zyra's breath caught in her throat. His stabilizing, she whispered. Carter slumped against the biobed, legs trembling. Told you, he said through labored breaths. We don't quit. The overhead speakers crackled to life. Radiation core stabilized. Casualty rate dropping. Medical team credited with 74% survival rate. Zyra met Carter's exhausted gaze. We defied every protocol today. And we saved lives, he answered. That's the only protocol that matters. She looked back at the child, chest rising and falling in defiance of the odds. The impossible had happened. And it was humans, the so-called Deathworlders, who made it possible. News of the Zelvery Station incident spread across the Galactic network within hours. Headlines flashed across 1,000 worlds. Deathworlder medics defy protocols, save dozens. Footage circulated of human responders hauling survivors through radiation-laced corridors, applying aggressive treatments that defied established medical guidelines. In one particularly viral clip, Jack Carter knelt beside a critical patient, hand-pumping oxygen through a manual resuscitator while flames crackled behind him. The caption read, "Humans, when machines fail, they fight." Across the galaxy, the response was a mixture of disbelief and fascination. Zelvery Councillor Taina Kaur addressed the press with barely concealed astonishment. Our protocols emphasize caution and calculated interventions, she said. The human team disregarded both, and their results speak for themselves. We must reconsider what we believed to be impossible. Medical boards convened emergency sessions to evaluate human techniques. The Interstellar Medical Consortium initially condemned the methods as dangerous. Then, reports revealed a 74% survival rate, more than double the predicted outcome. The condemnation shifted to curiosity. Zyra Kell found herself at the center of the storm. A reporter drone hovered near her as she stood outside the medbay, exhaustion etched into her features. "Officer Zyra," the drone prompted. "As a Zelvery specialist, how do you explain the human team's success?" She hesitated, memories of Carter's relentless determination flashing through her mind. "Humans approach medicine like survival itself is a battle," she said. "They push, adapt, and refuse to accept defeat. We followed protocol. They followed instinct and saved lives." The clip gained traction on countless worlds. Forums buzzed with debates. Could humanity's aggressive methods revolutionize emergency medicine, or were they too reckless? The phrase "we don't quit easy" became a rallying cry in medical circles. On Earth, medical training programs reported a spike in applications. "They've seen what our teams can do," one instructor said. "Now they want to be part of it." Back on Zelvery Station, Carter sat beside the alien child who had come back from the brink. The kid's breathing was steady, eyes fluttering as neural pathways repaired themselves. Zyra sat across from him. "You broke half our rules," she said softly. "Didn't come here to follow rules," Carter replied, voice weary. "Came to save lives." The child's fingers twitched. His eyes opened, confused but undeniably alive. Zyra exhaled. "The galaxy doesn't know what to make of you, Carter." He smiled faintly. "Good. Let 'em wonder." 2 days later, a new directive circulated from the Galactic Medical Authority, human emergency protocols to be studied for cross-species implementation. The galaxy was no longer questioning human audacity. They were trying to understand it. Because when Deathworlders entered a fight, even death itself had to step aside.